Have you been having problems with ankle pain or foot pain, or have you been worried about prevention of injuries of ankle or foot pain? If so, then this video series is for you. My name is Biagio Mata. I'm a physical therapist with Elite Physical Therapy, and today we're going to talk about something to provide you with some value to help give you some information about ankle or foot issues that you may be interested in. Today we're going to talk a little bit about ankle bracing. Do you need an ankle brace? Is an ankle brace something that would benefit you to help prevent problems, to help keep you from having future issues if you sprained your ankle, if you have an old fracture, and kind of the decision-making process? Obviously, every person and every patient is individualized, and this question has to be bounced off your medical provider to be able to make an informed decision about you. But just a few things that you might think about, or your physical therapist or your physician may think about when deciding whether to put you in a brace. One is, what type of injury are you recovering from? If you're recovering from a fracture and the fracture site is at a location that could potentially put you at risk, and you are an athlete, let's say, very likely we're going to have you in a brace during athletic activity while you are recovering, even after the fracture is healed, for at least some period of time to make sure the stability in the ankle is returned. So we want to prevent future issues with that fracture, and that's a good reason to possibly require or ask you to use a brace. Another reason might be is if you have a lot of ankle instability, meaning that if you have an old sprain, or if you have a history of multiple ankle sprains where you maybe have tears of the ligaments that are in that position there, and you don't have the typical stability that the ankle would have, a brace may be right for you to be able to help support that ankle in a position that is not being stabilized because the ligament anatomy is not there the way that it used to be. Another thing to consider is, have you actually rehabbed your ankle? So if you sprain your ankle and you don't do anything to rehab from it, I don't think that the answer for that is to go right into a brace and have that be the solution for fixing your issues. A big thing that you need to really make sure that you're doing is your physical therapy. So you need to be working on balance, because that gets messed up after you sprain an ankle. You need to be working on strength, flexibility, and motion of the ankle so that you have good motion of all the joints, of all the bones, kind of where they connect to one another, and all the muscles around there are strong and stable to be able to give you a good base of support. So those are some things to consider when making a decision about whether or not to wear a brace. There are lots of other factors to consider: activity level of the patient, the number of times that this injury has happened, the type of injury that it is. All of those factor into the decision making. I'm not I'm not anti-bracing and I'm not pro-bracing. I am pro making a decision that's appropriate for the patient in that particular circumstance. Hopefully you found today's information helpful and learned a little bit about foot and ankle issues, or how to prevent foot and ankle issues in the future for you. If you are interested in learning a little bit more about your body specifically, you can contact the office and ask to do a free consult with me. In that free consult, what we would do is go through kind of a mini exam and see what successful treatment might look like for you, or successful prevention might look like for you. If you're interested in doing that, give the office a call and just tell them I want to set up a free 30-minute consult with Biagio, and they'll know how to get you set up and to see me.